in the milestones of development, listening जो होता है, what is that? It is language. Language. So in silence we speak. How? By listening. Listening is also equal to speaking in silence. Language. That's the reason those who are having the auditory problem, hearing loss, their intellectual development also get impaired. In autoimmune Addison's disease, there is a steroid deficiency. Steroid also has mineralocorticoid activity. Normally mineralocorticoids lead to sodium retention, potassium loss. If there is no mineralocorticoid activity due to glucocorticoid deficiency of Addison, what will happen? Potassium loss won't be there. So potassium retention will be there. That lead to development of hyperkalemia is what you have to basically remember. What is true about Asperger's syndrome? Somebody who is online can tell what is India-South Africa final score. I think by now the match would have been over. Google may be giving you the final score. Sundays only they kept all India matches. Sundays are our mock test discussions. So I was feeling Sunday means stretch the legs and watch a cricket match with a popcorn in the hand is the happiest time of the life, right? So very good. 307 is the score. Oh, very good. 307. Quite a comfortable score. It's like getting 155 marks and waiting for counseling out of 200. By chance our classmates fight like South Africans and cross 307, we don't know. But you cross 155 means you are safe range. You can start celebrating for the success. So Dr. Asperger's syndrome, autism से कैसे अलग होता है? इन दोनों के बीच में फर्क क्या होता है? Asperger's is called autism spectrum disorder. There is a difficulty in social interaction and also difficulty in non-verbal communication. Along with that, there is a restricted and repetitive pattern of the behavior and interests, which is the feature of Asperger's syndrome. And how does it differ from the other autism spectrum disorders? There is a relative preservation of the linguistic and cognitive development. Language or cognition, they are not affected. They can do maths, they can do complex physics problems, they can write most beautiful song no one has ever thought of the literary words, but they have difficulty in social interaction and non-verbal communication. Why not? Normal will be the occupational functioning. Occupational functioning require a good communication. You may be a talented guy, but if you are afraid of meeting people, talking to people, occupationally we are all social creatures, no? Right? So somebody told the helpline person who is counseling is suffering from Asperger disorder because she is completely fed up in working 24-hour helpline. She was handling so many calls, ultimately she lost her basic function of a social interaction. Of course, today we are recruiting more people to take care of our helpline numbers. Our numbers are, people calling are increasing. So, for a good occupational functioning, you need to have a good social interaction, which is a basic premise. If you are a brilliant guy but a non-approachable guy, people will never come to you. You may be aims returned. But if you are not confident in talking to the parent of a pediatric patient, no one cares whether you are a PGI pediatrics or AIMS pediatrics. First is, you need to know how to talk with the parent, apprehensive parent of a sick child. Tomorrow, we also as doctors, The most important thing is not knowledge, talent, ability of differential diagnosis. First is communication. Right, doctor? Then angiofollicular lymph node hyperplasia. What is it? It is Castleman syndrome. So lymphoid hematoma, it describes a group of uncommon lymphoproliferative disorders, and it can be multicentric Castleman's disease. In this there is a hyperactivation of the immune system, and if you take the histology, it will be angiofollicular lymph node hyperplasia. This is called as Castleman syndrome. This is little unexpected, unlikely, outlier kind of a question. If you answer this wrong, don't worry. Okay. Now, doctor, the most common cause of this stridor in infant. Oh, ये तो biscuit question है. Laryngomalacia. For this question, if you guessed something, thought something, and answered something, oh, that means you didn't prepare for the exam. ENT में क्या होता है, doctor? Today afternoon you have got a ENT class. Please do come. ENT में एक vocal cord paralysis वाला question होता है. One Ishiki thyroplasty will be there, and one question will come on nasopharyngeal and laryngeal carcinoma staging and treatment, right? And CSOM, types of mastectomy. So totally 10 to 12 topics, say maximum number of issues are all taken care, right? So you should get full score in ENT. Monkey faces and the baggy pants refers to what? Typically it is a look in marasmus because of the loss of the fat, is what you need to remember. Pemphigus neonatarum is one of the variants of the bullous pemphigoid. Bullous impetigo is what you have to basically remember. Erythrasma is because of the Corynebacterium minucitum. Then in leprosy, what are the newer group of drugs? Ufloxacin, minocycline, clarithromycin, they are all basically what? The newer drugs. Then what is a paresthesia? It is an abnormal sensation perceived without an apparent stimulus, is called as paresthesia. Histamine, typically atracurium, is the one which is associated with the release of the histamine. Then depression में क्या होता है? Suddenly you are waking up at 4 o'clock in the morning and studying means it is not that studious nature. You are depressed about how I am going to manage this exam. So early morning awakening, insomnia, they are all the features of depression. But let me tell you, depression, tension, anxiety, artificial, hyperadrenergic, serotonergic phenomena, which you should be rising over and above that. Then mental status examination, what is accept about it? Basically, you have got appearance, speech, eye contact, motor activity, affect, mood, cognition, perception, thoughts, behavior, insight, judgment. They are all the various things which you will be assessing whenever you do the mental status examination. Abstract thinking, judgment, perceptual disturbances, not logical reasoning. You may be mentally fit in spite of inability to do mathematical calculations. Logical reasoning is not the part of it. Ross classified into 5 stages. What are those 5 stages into? What are those 5 stages? Death. He classified death. Grief and?
Grief because of the loss of loved one. They are not stages of after and death. Stages of grief, we call them stages of grief.
No, I'll tell you. Kubler-Ross, 5 stages of dying. When you tell the patient, sir, you are having a metastatic small cell lung carcinoma. First thing what he'll say, oh come on doctor, I did not smoke any time, I did not harm anybody, I am never rude on the helpline, so I am such a nice person, why will I get this? Denial and isolation. Then anger, how dare God do this to me? मैंने कितने बार बालाजी के पास गए, तिरुपति गए, then bargaining. Oh, let me live to see my son become a graduate. Until then, let me live, God. Let it not metastasize. Further, go take me away. Then depression. I can't bear to face going through this. Patient will tell, my wife will be crying every day before my photograph when I die because my mom did like that. Maybe the patient's wife will tell, अगर ये जल्दी मर गए तो तेरा relief मिल जाएगा, कितने दिन ये suffering देखते बैठना पड़ेगा. Then finally acceptance. He will tell, I am ready God, I don't want to struggle anymore. That time you will do the repeat MRI and find that the lesions have vanished. So once more all the stages he has to pass through. Right? So that is the reason doctor, even when we get our APPG entrance results, first is, this is not happening to me. Then comes, Murli Bharadwaj sir, why? I attended all mock tests of you, still I got this much a big rank. Then, okay, let the DNB exam come. I am going to crack it. Then you will, अगर मैं प्रिपेयर ऐसे ही कर रहे तो कब शादी होना है. Then ultimately, yeah, once more the November All India entrance will come. Then you will tell, I am ready, I don't want to struggle anymore. So doctor, if you can pass through all these stages quickly, that is your maturity. If you are a mature person, you can overcome all these things very fast. Another favorite MCQ in exam. When do you call? Beyond how much period you continue to be in a grief, you call pathological grief. More than 6 months, pathological grief. Co-occurrence of 3 psychiatric disorders in a single patient is called as comorbidity.
More than 2 or more than or equal to 3 same?
More than?
More than 2 or more than or equal to 3 both are?
Oh, really? More than 2 and more than 3 should be equal because 2 is a subset of 3 bolke matrices mein our mathematics teacher told. No, I'll tell you. More than 2. Oh, there is no 2.5 there, you meant to say. No, the point is minimum.
Minimum 3. More than 2, minimum 3.
More than 2, minimum 3. How about if the little tricky? Yeah, I think the straight definition was kept. Maybe they should make more than 4 etc. Because more than 2 become, or more than 2 should be removed. 1, 2, more than 2, more than 3. Sorry, more than 3, more than 4. I think more than 2 should be equal to 3 because even 3 is considered to be comorbidity. Agree? Right. Mini mental status examination is for what, doctor? Dementia. Right? Then what is the latent period for the acute osteomyelitis in extremities and spine? This is unreachable question. Khali guess mark ke aana padta exam mein. Negative marking is not there, no? APPG, TGPG, comfortably you can do that. 8 to 10 days and 21 days. Which is not a contraindication for performing a histosalpingography. Basically, for histosalpingography, there are 3 important: contrast allergy, pregnancy, active pelvic infection. The absolute contraindications for the procedure is what you have to basically remember. Which is the earliest radiological sign of a bone infection? Presence of soft tissue edema is an important indication. So what is the half-life of cesium? It is around 30 years is the half-life, and it proceeds with both the beta decay and also gamma emission. Advanced head and neck cancer agar hai to, what AB you will be giving along with the concurrent radiotherapy? Once more doctor, 2 AB questions. वो Wikipedia में table है ना AB वाला table, monoclonal antibodies. Today only after going home quickly you need to review. So it is cetuximab, which is the one. Cetuximab is the one which is used in order to treat the head and neck cancers.